In this video we are going to discuss a case of Edwards syndrome. A one-day-old female neonate is brought to the neonatal intensive care unit due to difficulty in feeding and weak cry. She was born at term to a 38-year-old mother. On examination, the baby has low birth weight, prominent occiput, micronathia, and low set ears. Her hands show clenched fists with overlapping fingers. The feet have a characteristic rocker bottom appearance. On cardiovascular examination, a harsh systolic murmur is heard. Why is it Edwards syndrome? First, we need to identify key clinical features from the case as follows. Difficulty feeding, weak cry, low birth weight, prominent occiput, micronathia, low set ears, clenched fists with overlapping fingers, rocker bottom feet, harsh systolic murmur, advanced maternal age, 38 years. Clinical reasoning. Reasoning starts with advanced maternal age. In this case, the mother is 38 years old. We know that increasing maternal age is associated with a higher risk of meiotic non-disjunction leading to chromosomal aneuploidies such as Down syndrome, Edwards syndrome, Patau syndrome. This raises suspicion for a chromosomal disorder early in the case. Here we can kind of exclude sex chromosomal abnormalities. Next would be dysmorphic facial features. The neonate has prominent occiput, micronathia, low set ears. These are classic craniofacial abnormalities seen in Edwards syndrome. Perfect reason to conclude it as Edwards syndrome would be hand abnormalities, as it plays a role as key diagnostic clue. It is the most characteristic feature, and that is clenched fists with overlapping fingers. Typically, index finger overlaps the third finger. Fifth finger overlaps the fourth finger. We can say that this is one of the hallmark findings of Edwards syndrome and is highly suggestive clinically. Next one is rocker bottom feet. The feet show a convex plantar surface resembling the bottom of a rocking chair. It is a classic finding which is strongly associated with Edwards syndrome, sometimes seen in neural tube defects and other chromosomal anomalies. Congenital heart defects. A harsh systolic murmur suggests an underlying congenital heart disease. Common cardiac defects in Edwards syndrome include ventricular septal defect, VSD, patent ductus arteriosus, PDA, atrial septal defect, ASD. Congenital heart disease is a major cause of mortality in these infants. Now let's discuss pathogenesis in brief, how it actually happens. This disorder is caused by meiotic non-disjunction at chromosome 18 leading to trisomy 18. Most cases occur sporadically and are associated with advanced maternal age. Cytogenic basis in this case, 47, XX, plus 18. This indicates 47 chromosomes. Female child, extra chromosome 18. Differential diagnosis. One of the differential diagnosis is Patau syndrome. Why it should be considered. Cleft lip, palate, holoprosencephaly, polydactyly, microphthalmia. Why less likely? The case lacks polydactyly, midline defects, cleft lip, palate. Next one is Down syndrome. Why it is considered. Flat facial profile, epicanthic folds, single palmar crease, hypotonia. Why less likely? The classic overlapping fingers and rocker bottom feet are not typical of Down syndrome. Congenital heart disease without chromosomal disorder. Could explain the murmur and feeding difficulty, but cannot explain dysmorphic facies. Overlapping fingers, rocker bottom feet. Coming to investigations. First one is karyotyping. It is a gold standard investigation which confirms the diagnosis that is trisomy of chromosome 18. Second investigation is fluorescence in situ hybridization, helps in rapid detection of chromosomal abnormalities. Third one is echocardiography, used to identify congenital cardiac defects such as VSD, ASD, PDA. Fourth one is ultrasonography, may detect some associated anomalies like renal malformations, CNS abnormalities. Fifth one is prenatal screening, if done antenatally, may show increased NT means nuchal translucency. IUGR means intrauterine growth restriction. Polyhydramnios. Thanks for watching. Like, share and subscribe to my channel for more interesting cases. Comment below if you want a brief explanation of the disease in proper before diagnosing.